Hey, it's Dr. McKinney at Blue Mountain Wellness. I wanted to do a short video just to talk about some of our services. I recently did a YouTube video. I did a webinar. You can check it out on our Blue Mountain Wellness channel regarding specifically neuropathy. It's one of the things that I specialize here in our clinic. We've been serving neuropathy patients since 2019, and we've had tremendous success over the years. One of the shortcomings and pitfalls that I've had is I haven't been able to scale outside of our business and help patients. So the last couple months since I did the last YouTube video, I noticed that a lot of the traffic was coming in from out of like our area, out of our demographic. And I thought to myself, how can we help these patients that are further away? In fact, I had a few phone calls with some of these patients, and I've got a solution. So this is what this video is about. I have a solution for how we can help you. I will say one of the things that I pride myself in is when patients come into the office, we do a lot of testing, diagnostic tests. It could be x-rays, it could be thermography, it could be sensory tests. Sometimes patients have, a differential diagnosis than actual neuropathy, like plantar fasciitis, a radicular issue like sciatica, and it can cause pain in the feet. So I do want to preface that with me working with potential clients outside of my office, I'm going to be a little more stringent with who I work with. Major demographic I want to really focus on is diabetic peripheral neuropathy. We have to ensure that it's not too far progressed as well. But there's a couple key components that we can use to help with this demographic. We do a gut reset. We work on resetting the gut, okay, at a cellular level, detox the body, get inflammation out, okay? That's step one. We have to reduce sugars. So that's through some dietary things. That's also through some metabolic circadian rhythm changes, okay? And then there's the whole dynamic of blood flow. When I have a diabetic neuropathy patient, it's not a question of if, it's a matter of fact that these patients do not have good blood perfusion into the periphery. And because of that, because there's a lack of proper blood flow, the nerves start to suffer, they get damaged. I mean, the nerves stay healthy from rich oxygenated blood supply that brings nutrients, okay? And with the diabetic, we have inflammation because the sugar levels are up, and we start to get atherosclerosis, we have hardening of the arteries, and we have an impeded, decreased flow of blood, flow of nutrients and oxygen to those nerves, and they start to demyelinate, okay? So I have patients all the time come into my office. They're like, Doc, I've been taking the supplements that you recommend. I've been doing some of these different things. And the problem is, if we cannot increase the blood flow, if we cannot increase the blood flow and get those nutrients there, you might as well just flush those supplements down the toilet, because they're not getting what needs to happen. So healing starts from the inside, okay? It starts from the inside at a cellular level. I have the most confidence that with a diabetic, patient, that we can help if they're willing to help themselves. Type 2 diabetes, and then when I talk about diabetes, I'm mainly referencing type 2 diabetes. Type 1 juvenile, that becomes a lot trickier where you're insulin dependent. But type 2 diabetes is reversible. I don't care what your medical doctor says, your family, your friends, it's absolutely reversible, okay? Now, there's definitely instances that it cannot be reversed, but by and large, we can help with these patients, okay? And one of the tricky parts about neuropathy is that patients come into my office and then sit down and they're like, Doc, the burning at nighttime, the pain, the numbness, like it wakes me up. I can't walk. It hurts. It's just nothing stops it. I'm taking gabapentin. I'm taking Lyrica. I'm taking Cymbalta. I'm taking different types of drugs. It's not working. I've tried this. I've tried that. And then when I start talking about their sugar, it's like a disconnect. And you have to understand that the cause is the cure. So what we have to do to cure the problem is go to the cause. And the root cause of high sugar is a systemic imbalance, okay? And mind you, those suffering with neuropathy, that might be driving them nuts, but don't forget what this is doing to your heart, what this is doing to your other organs. This is affecting your entire body. There's a reason that the eye doctor can look in your eye and say, hey, you have diabetes. And you say, well, I've never been diagnosed with that. And then you do a glucose test, and guess what? The eye doctor was right. Your body starts to change when it's out of sync and out of balance. Okay. So, I'm taking on a handful of diabetic neuropathy patients. And I'm ready to do this. I have my nutritionist here at Blue Mountain Wellness. We have an excellent program. It's called TYB12. It's a 12-week transformation protocol that we do. And it's really the framework for a lot of different avatars of patients, whether it's diabetic, they're looking for weight loss, they're looking for, just hormonal balance, just flushing out their system. It's the framework, and then we put a spin on it. So TYB is excellent. And what my nutritionist has done is taking what she does in the clinic, and she has made an online version of that. So you can follow along at your own pace and do this without coming into Blue Mountain Wellness, okay? I've worked with some different vendors so that I can get different equipment to promote proper blood flow and to help with healing. The equipment, it's state-of-the-art stuff. I have some of the most amazing equipment here, and we have tens of thousands of dollars of different things that I put my patients on. And there's no doubt that speeds up the healing process. But I've been able to put together a couple key components that my patients can do at home. Do it at home with success. But again, it's taking multiple things, putting them together to allow the body to help heal and repair itself. And that's ultimately the thing. Like, I don't have a quick shiny, here's some supplements to take, or here is some medication, or here's a procedure that we do that fixes this problem. And anybody that tells you otherwise, trust me, I've been dealing with neuropathy for years. My grandfather had diabetic neuropathy. When I was a young kid, I used to watch my grandmother have to change his wound. She had this pink basin, and she'd have his foot in there, and there was the gangrene, and she'd go in there and clean from where they had to do amputations, and then it was another toe, and that affected his quality of life. I mean, he became handicapped. He was a big hunter. He was an avid hunter, so I used to go sit in the car with him because he was handicapped, because he couldn't walk. He had no balance, but his quality of life had just diminished. And this is something that really resonates with me. I'm very passionate about, because I saw what it did to him. I've known neuropathy my whole life, and like I said, since 2019, we've been doing things here at Blue Mountain Wellness to treat it, and we have tremendous success with the diabetic neuropathy population. If you are willing to make the changes. If you're not willing to make the changes, I'm not going to work with you. It's just I value my time too much, and I don't want patients to work with me and say that, Dr. McKinney, I'm not getting better, because it's such a small exception of patients that don't see tremendous improvement by doing my protocols. I mean, I'm talking life transformations where it's weight loss, more energy, less pain, less inflammation, and just more vitality. I mean, we do pre and post blood work on a lot of patients here in the clinic, and it's amazing the difference. Cholesterol levels dropping down, and the sugar levels regulating, and just other the creatinine, like the stress on the kidneys and things like that are measurable by blood work. And trust me, blood work is not always the best labs to go off of, because by the time stuff is out of sync on blood work, it's really bad. So just remember that. So if you are interested in hearing more about my program that I have to offer, the first step is to get a phone call with me. I need to go through a case history. I need to ask you different questions. I need to know that you're on board to do what I have to offer. And I'm really looking forward, though, to expanding outside of our walls to offer this. We'll be able to drop ship, nutrients, equipment, things like that. And then I have a whole string of different homework for you to follow. But it's very attainable, whether you're retired or you're working full time, or you're juggling a million things. You got to make time for yourself. but I've been doing this, like I said, long enough. I'm confident that I can help, um, as long as you fit the criteria. And that's why we got to get on a phone call. So we get on a phone call, and you look at a good fit. Then we'll talk about what steps that, in order to help you with this. And I'll give an idea of how long that I think it's going to take to see these results. But again, I'm really excited about this because, the last thing I want to do after posting my video is have patients where I'm like, I'm sorry, we're in Fredericksburg, Pennsylvania, a small town, it's rural, and I can't help you. So I do want to be able to help you. If you do have a neuropathic, it's idiopathic, or you don't know the cause from it, or it's chemical induced, or, chemotherapy induced, or something else, you can still reach out to me. My level of confidence of, how your case will respond to that, it really depends digging into a deeper history. Because again, one thing that I can't do, I can't physically get on there and touch you and do the sensory testing. I can't sit there and do a thermography to see if you have normal blood flow or if it's abnormal. There's a lot of different things that I can do in the clinic. But again, if we know that you're pre-diabetic or diabetic, I really want to help you out. So it's going to be limited at the beginning here, who I can take, how many I can take. I want to be able to scale and help as many people as I can, and if I can't help you out, I'll try to point you in the right direction. So by all means, reach out if this is something that is of interest to you. And we look forward to helping you. I have a link. I will put a link in the comments here, in the info about this video, and then you'll be able to reach out to me. So, and if you post your question, I'll try to get back to it. I don't go on the YouTube a whole lot. We do have a very busy clinic here at Blue Mountain Wellness. But like I said, I'm looking forward to helping more patients out. And there's no dumb question. There's no, there's, I can make time. I can make time for you. I value your time. I just hope that you value mine. And I hope we can work together. So God bless, and we look forward to helping you out.